Hey guys, just a few minutes. We are trying to put the camera on the Instagram live. A few minutes.
You're now live.
Hey guys. Welcome back to Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. This is our weekly check-in to discuss different topics in plastic surgery and to answer your questions. So today we're gonna talk about how to get ready for surgery. So last week we were talking about how to get a consultation. And we talked and discussed everything that happens for when you're interested in the procedure up to where you have your surgery date, right? And I mentioned a few things about the pre-op clearance, but because of it's a whole topic on its own, I decided to separate it and focus on it today. So we're talking about today the getting ready for surgery. So you have your surgery day already and it's coming up. So what are the things that we do to make sure you're healthy for surgery, okay? And I think this is one of the most important topics, right? We talk about patient safety, we talk about what are the things that we need to optimize to get ready for surgery. So checking your health, making sure you're ready for general anesthesia and for the procedure you're having, it's extremely important, okay? Patient selection and patient optimization are the most important things to decrease complication rates and make sure that you're healthy enough to undergo the procedure that you're interested in, okay? So I know this process may be a little bit hectic, maybe a little bit not enjoyable because it takes time from your schedule, takes time to get all the blood work, to see your primary care, to make sure that you have all your paperwork ready, but it's all to protect you and to make sure that you're healthy to undergo the stress and the surgery, okay? Anesthesia, surgery, okay? So when does it start? It starts 60 days before surgery. Why 60 days? Because we don't want to do the labs and the blood work too soon, and then it's not, and you have to repeat it, okay? So that's why it's 60 days before surgery. If you book your surgery with less time, let's say you book your surgery and it's in a month, then it's obviously gonna be after you book, okay? But if you book in advance, 6 months in advance, you have your date, you're having surgery in June of next year, don't worry, you'll get a call 60 days before your surgery. And the call is going to be for one of our pre-op coordinators, okay? The pre-op coordinator is going to give you a call. Make sure you take time to get this call and you're not like in the middle of something, picking up kids from school and trying to juggle a bunch of stuff at the same time. Why? Because she's going to tell you a lot of important information. And not only important information, important dates, important things that you need to write down, okay? So it's important that you take your time, and if she calls you and you're in the middle of something, you can tell her it's better for me if you call me after 5 p.m. or whatever it is, right? And coordinate the call so you are calm, you have something to write down, either a notebook or you have your phone ready to write down the dates, the times, and the things that you want to order and the things that you want to remember, okay? Also, she's going to give you all these dates, the blood work, but she's also going to send you an email or through the patient portal, all the information that you need written down, okay? So don't think that you need to remember all this information. Everything is going to be written down, okay? And I'm going to tell it now, but also, and it's going to be in our YouTube and my Instagram page so you can review it. But also she's going to tell you on the phone, and also you're going to get it with your package of information that you received prior to the surgery, all the things that you need, okay? So 60 days before surgery. Why 60 days? Because the labs should be within 2-month period, okay? What are the labs that I order to make sure that you're ready for surgery? One is a CBC. A CBC, what it does, it checks your white count to make sure you don't have any infection and you don't have any immune problems or that would cause wound healing problems in the long run. Okay, so white count is important. Hemoglobin and hematocrit, okay, that's your blood count, okay, to make sure that that you have a good blood count to sustain surgery, especially for liposuction cases, which they're correlate with a lot of with surgical bleeding. Okay, so you have to have a hemoglobin and a hematocrit that is at least more than 11. Okay, it's better if it's more than 12. Okay, between 11 and 12, it's okay, but we need to be very aggressive with the iron supplements, and also we're going to use the cell saver. We're going to use the cell saver in everyone, but especially if you're under 12, between 11 and 12. Okay, so try to get that hemoglobin level above 12. Okay, below 11, I have a few patients with history of anemia. Below 11 is just too risky. Okay, let's remember that I'm doing surgery in an office-based surgery center. Okay, I don't have a blood available here. If you get unstable during the procedure, I don't have that available in here. Okay, that's available in a hospital setting. Okay, so it's very dangerous to go and do a surgery when your hemoglobin and hematocrit is not optimal. Okay, so if you do the blood work and it's still too low, you might need to reevaluate this. You might need to see a hematologist, which is the doctor who specializes in the blood, and he can help you with what's the cause of your anemia, what supplements you might need, okay, because you might need other supplements other than iron, okay, and what is the cause of it and how to target it, okay. But the most important thing is to get it above 11, okay. The other thing that we check with the CBC is the platelet count. Platelets are one of the most important factors for coagulation, okay. So forming blood clots, which, I mean, we don't want to be extreme, so it needs to be within the normal range, but it's very important for controlling of bleeding, okay? So those 4 things we check with the CBC, okay? CMP, which is the chemistry panel. What is that? It checks your electrolytes, checks your kidney function, checks your liver function, checks also the sodium, potassium, chloride, all of those things that are extremely important. Why? Because of specifically general anesthesia, okay? When we put you under general anesthesia, we give you medications that may alter, and they rely on the metabolism of the body, which is the liver and kidney, okay? So we have to check that those things are good so you can tolerate a general anesthetic, okay? Also, your sugar level is checked on this chemistry panel, or CMP, if you are diabetic, or if the sugar level is uncontrolled, then we might ask for another blood work, which is the hemoglobin A1C, or the glycosylated hemoglobin, okay? This lab tells us what has been your sugar level in the last 3 months, okay? If you're a diabetic, you're pretty used to hearing this A1C, because it's the way that diabetics monitor their diabetes and make sure that it's controlled. But in case you don't know, that's the reason for the blood, for that blood test. If you need to get it done, we'll let you know, okay? But if you're a diabetic, make sure that you remind us that you have that condition, okay? Because we have to check your A1C, and the A1C needs to be below 6.5, okay? That tells us that your sugar levels have been controlled. Why is so important? Because uncontrolled sugar levels increase your risk of infections and increase your risk of wound healing problems, okay? So it needs to be well controlled, okay? You can be a diabetic, but it needs to be well controlled, okay? What else? The PT, PTT, INR, okay? All of those, it's just 3 values, PT, PTT, and INR, that tells us coagulation, okay? Basically, that your blood, it's forming clots the right way, and we're not gonna have a problem with prolonged bleeding time, okay? HIV, we do on every patient as a safety measure for our clinic, okay? If you're HIV positive, it doesn't mean that you're not a candidate, okay? If you're HIV positive, we can still do the surgery. We're just gonna order extra tests, including a CD4 count and a viral load, to make sure that it's controlled. And if it's controlled, then yes, you're a candidate, but we're gonna be more thorough in the cleaning and the instruments that we use to make sure that we clean the entire room, terminal cleaning of the room. So we take an extra step, and that's the reason why we check it on everyone, okay? The last one, HCG, that's the pregnancy test, okay? We order it, if you're female, obviously, we order it in blood, okay? And we check it beforehand to make sure it's under control. And then the day of the surgery, we also check, but it's in a urine test, okay? Just to make sure it's negative. With the urine test, we do 3 things. We check toxicology to check other drugs in the system. We check for nicotine, okay? And we check the pregnancy. So those are the 3 things we check the date of surgery on urine, okay? So those are the blood work that everyone needs to do, okay? There are some special cases, like I mentioned, diabetics need an A1C, HIV positive patients need the viral load and CD4 count. If you are a thyroid patient, hypothyroidism or hyperthyroidism, we're gonna order TSH and T3, T4 levels, which are the levels of thyroid in the blood, to make sure that's under control, okay? So these are like in general, but if you have any medical conditions, we might order extra tests just to make sure that's good, okay? Clearance from, and 2 months, at least 2 months before the surgery, but you need to have everything sent in to our office at least 3 weeks, a minimum of 3 weeks before the surgery, okay? So don't wait until the 3 weeks to start the process of getting all the blood work, because it takes time, okay? It takes time for the lab to give you an appointment, the results to come in, okay? And if we don't have everything, why 3 weeks? But because you send everything in, I review it, anesthesia reviews it, okay? And we have to make sure that everything is set for the surgery, okay? So if we don't have the things here in the office by 3 weeks before, we might need to change your surgery date, okay? So make sure you do things on time, and that's why we call you 60 days before, and we give you all the information so you have plenty of time, a month and a half, to get everything ready and sent in, okay? So the other thing is the clearance from your primary care physician, okay? Some people say, I'm healthy, I'm young, I don't have a primary care. Okay, but it's super important that you have a medical doctor review all your conditions, all your labs, and make sure that everything is in order before you come in, okay? I don't want you flying in, coming in here, and then we finding out things the day of surgery, okay? I want a doctor to evaluate all your past medical history, your conditions, your blood work, your family history, everything, all the surgeries that you had in the past, and make sure that you're optimized for surgery, okay? And you might think, but Dr. Vidal, you told me that 3 weeks before when I sent everything in, you check it. Yeah, but I don't examine you, okay? I check your blood work, and I check that the EKG and the things that you send in, but I'm not talking or examining you, okay? So it's important that a doctor sees you and examines you and checks everything, okay? And also, I'm a surgeon, but they do the medical part, okay? And they make sure with all the conditions and everything that you are optimized for general anesthesia and surgery, okay? So we work as a team, and the part of the primary care clearance is extremely important, okay? So everyone needs to send a primary care doctor clearance, okay? It's important to plan ahead of time, okay? Sometimes the primary care gives you an appointment in a month, okay? So if that's the case, call in advance, okay? You're gonna need to see him. Most doctors then will see you one time and then see you a second time with the results of the blood work, okay? And then they'll give you the clearance, okay? So if that's the case, it takes time. Just plan ahead so you're not at the last minute trying to rush the medical clearance and the lab results, okay? EKG, everyone, it needs to send an EKG. And the EKG, I put the little picture here so you see it. This is what we need, okay? Is the actual tracing. And why? Anesthesia checks this, okay? Checks your cardiac rhythm. And it's important that we have it in our file, because if anything happens under general anesthesia, this is our comparison, okay? We check your baseline heart rate and your baseline rhythm, okay? And compare it to anything, if anything happens during the procedure. So this baseline is extremely important, okay? It's not only EKG normal, okay? We need the actual tracing, okay? And the EKG is good for 6 months. So if you had an EKG done 3 months before, you can send that one, okay? It's a baseline one. If you have any cardiac conditions, then it's different. If you're a healthy person without any cardiac conditions, then it's good for 6 months, okay? Chest x-ray, if you're older than 40 years old, we need to do a chest x-ray, okay? The older we get, we tend to have more problems with our lungs, and that may interfere with general anesthesia, okay? So it's important that if you're over 40, you get a chest x-ray. Chest x-ray is good for a year, so if you had a chest x-ray a couple of months before from another reason, it was normal, then we can accept that one, okay? The chest x-ray is good, only the report, okay? We don't need to see the actual imaging, okay? So the report from the radiologist is good enough. Mammogram. Mammogram if you're getting a breast procedure, okay? If you're getting liposuction, BBL, any other procedure, you don't need to send a mammogram. But if you're getting a breast lift, breast reduction, breast augmentation, and you're over 40, then we need to see a mammogram, okay? The other is if you have a positive personal or family history of breast masses or breast cancer, okay? If you have a positive family history of breast cancer, it's a direct first relative, okay? Not the second cousin relative. It's your mom, your sister, grandma, okay? So first line relative. And you need to start the mammograms 10 years before when they were diagnosed, okay? So let's say your mom had breast cancer when she was 40. Then you have to start your mammograms when you're 30 years old, okay? So that's important. When was the diagnosis of breast cancer in your family member? And you start 10 years before that, okay? If you had personal history of breast cancer, then we need to see a mammogram. Mammograms are good for a year unless the mammogram found something abnormal, okay? If the mammogram found something abnormal, usually the follow-up on mammograms are in 6 months, okay? So it depends, but if it's a completely normal, benign appearing mammogram, then it's good for a year, okay? And this is for everyone, but special circumstances, okay? Special circumstances require special clearances, okay? So if you're diabetic, if you have a thyroid condition, then you're gonna need to see an endocrine to make sure that you're cleared for surgery. If you have cardiac problems, you need to see a cardiologist. If you're over 50, then you need to see a cardiologist and get a cardiac clearance, okay? Even if you're healthy, even if you've never seen a cardiologist before. Why? Same reason with the primary care, okay? I am not seeing you and I'm not evaluating you until the day of surgery. Over 50, we have associated medical conditions that can interfere with general anesthesia, okay? So we need to see a cardiologist clearance if you're over 50, okay? If you have any cardiac history or any symptoms such as fatigue, chest pain, the cardiologist might require an echo or a stress test. That's up to the cardiologist, okay? If we see any abnormalities in the EKG, we might need to order a stress test or echo, okay? And we are gonna let you know, okay? So all of these things are important, and that we go back to timing, right? Try to get everything done right away after we give you that call of the 60 days before surgery, so you have time, okay? In case the hemoglobin is too low, in case your sugar levels are high, in case your thyroid levels are uncontrolled, in case we ask for you to see endocrinologist or cardiac or anyone, okay? So you have plenty of time to adjust so you don't miss your surgery date, okay? So these are basically for everyone. We also ask you to start iron supplements at least 45 days before the surgery, okay? If you can do 2 months, even better. That's gonna help you boost your hemoglobin and hematocrit levels so you are optimized for surgery, okay? Surgery involves bleeding, okay? I can do many things to try to control the bleeding, but there's gonna be bleeding, okay? So we have to make sure that you're optimized as much as possible, especially on the hemoglobin hematocrit, especially if you're doing liposuction BBL procedure, okay? So your supplements are very important. Iron and folic acid supplements are extremely important, okay? All of that supplements information and recommendations are written in the paperwork that we sent, okay? So don't be like trying to write everything down, and don't think that if you missed anything, don't worry. Everything will be sent to you written down so you can review it and you can check it, okay? And that's pretty much the pre-op workup, okay? Again, 3 weeks before, send everything in. I evaluate, anesthesia evaluates it. It depends. Sometimes we may require extra stuff. Again, just remember, it's for your safety, okay? We just want you to be optimized as much as possible and ready for the surgery to decrease complication rates as much as possible, okay? I'll take some questions now if you guys have it.
Yes. As for emphysema.
Okay. Emphysema depends on the severity of it, okay? Emphysema may affect your oxygenation in blood, okay? So if you have a severe case of emphysema, you might not be a candidate for surgery, okay? If you have emphysema, but it's very mild and you're not in any supplementation and you're controlled, then you might need to see a pulmonologist, the lung doctor, and they might require to do what it's called respiratory tests to make sure that the function of your lungs is good, okay? As long as your functional capacity, your lungs are working okay, and you don't have any restrictions, then you might be a candidate, but that's a case-by-case thing, okay?
Okay. When I should stop smoking?
Stop smoking at least 30 days before the surgery. It's better if you stop 2 months before, okay? The wound healing part of the effects of nicotine in your body will be gone by 1 month, but studies have shown that anesthesia effects can still linger in your lungs, and it's what the smoke does is creates what it's called a reactive airway. So your lungs are a little bit more reactive to anything, including the tube of the anesthesia and the gases that we give you, okay? So it's better if you stop smoking 2 months before to decrease that reactivity in your lungs and decrease anesthesia-related complications.
Okay, in Saint Soul, ask, can you do a Vixen look?
Yes, so Vixen looks, it can be achieved, but usually they require more than 1 round, okay? Vixen looks are very dramatic changes in the waist to hip ratio, okay? When we're injecting fat in the hips is usually an area that it's hard to take the fat. Why? Because the blood supply in the hips is not as good as in the buttock, okay? The reason for that is just the anatomy, okay? The hips is full of ligaments and hard tissue, okay? Not like the buttock, which is more soft, more blood supply in the area, okay? So the amount or the rate of fat survival in the hip is not as great when compared to the buttock, okay? And also, when we do a Vixen look, like I said, the range and the difference is very dramatic. So we might need to do several rounds to get to that point, okay? Remember that I'm injecting in the subcutaneous piece, okay? I'm not injecting in the muscle. Sometimes those Vixen looks that you see on 1 round is because the surgeon is injecting in the muscle, or it had injected in the muscle, and the muscle expands more and lets you inject more fat. But as we all know, it's extremely dangerous, and we can end up having a piece of that fat go into your venous system and cause a fat embolism that may end up in death, okay? So that's the reason I do not inject in the muscle, and that's the reason why a Vixen look might take more than 1 round.
Are consultations only virtual, or can we do in-person consultation?
In-person consultations are possible, yes. So the process starts with the virtual consultation form, okay? That's like we discussed last week, and you can check the video, it's in my Instagram to go over it. But it's basically, you go to our website, pureplasticsurgery.com, and you go to virtual consultation, click there, and it's a form. That form, it'll ask you a bunch of information, demographics, past medical history, your goals, and also for pictures. Okay, once I evaluate those pictures, we can tell you if you're a candidate or not for the procedure. After that, then you can go ahead and schedule a virtual or in-person consultation. Okay, your coordinator is going to help you schedule that if you're interested.
Okay, how about injecting fat on the breast?
So fat transfer to the breast, I do not do it. Okay, the reason, it's two main reasons why I don't do it. I used to do it a lot for breast cancer patients because it's different. Okay, they don't have breast tissue. Okay, the breast had been removed. For us that we don't have, that we do have breast tissue, the problem with fat transfer to the breast is that that fat that we transfer sometimes doesn't survive. If the fat doesn't survive, it forms cysts and lumps, okay? In the buttock, because it's more hidden, we don't really feel it, and we don't have to be checking for breast cancer in the butt, okay? In the breast, we have to do our mammograms and ultrasounds to check for breast cancer after we're 40. And with the fat transfer, then you don't really know if those lumps or cysts are a new mass concerning for cancer or it's a product of the fat transfer. So it ends up requiring multiple biopsies usually in those patients to rule out cancer, which usually is not, okay? And the other reason why I don't like to do it is because the blood supply on the breast is not as good as in the buttock, okay? So it usually requires multiple surgeries, okay? Multiple fat transfer procedures, at least 2 to 3 surgeries to get to at least a cup size difference, okay? When we have breast implants available that are very safe and can give the result that you're looking for in one surgery.
Is it true that you can lose more than 30% of the fat in the BBL?
Usually it's 20 to 30% that what you lose. You can lose more, okay? But usually it's 20 to 30% the fat that you lose, okay? What are the things that are important is your post-op care. Extremely important to try to get that percentage as low as possible, right? What are the things that I'm gonna ask you to do is not put pressure in the fat transferred areas, okay, for the first 6 weeks. So no sitting. You're going to be sleeping in your belly, okay? Trying to avoid pressure to the fat grafted areas. Your diet and your nutrition is going to be super important, okay? I don't want you losing weight, okay? That's not the time to lose weight. Your time to lose weight was before, if you wanted to, okay? After the fat transfer, I want you to maintain your weight and also increase your healthy diet, your healthy fat components in your diet, okay? And also, it's very important to wear your compression to mold that area, okay?
Okay, how much fat can be injected into the buttock?
That's very, very individual, okay? So usually around 1,000 to 1,300 is usually the mean that I can inject, but I've had patient in each buttock, correct, in each buttock. But usually there are patients that I can inject more and there are patients that I can inject less. It has to do with your skin elasticity. It has to do with the amount of subcutaneous space that you have, okay? There are people that the skin and muscle is very close by and there are people that have more space, okay? And also it has to do how much fat I have available, right? If you are a low BMI patient, BMI 20, 21, you're very skinny, I might not be able to get 4 liters of fat from you, okay? I might be able to get maybe 1,500. So what I can transfer is usually 750 and 750, okay? So it all depends. It's very individualized, okay? What criteria or what are my guides to know how much to transfer? It's our pre-op discussion. So on pre-op day, the day before your surgery, we go over your goals and expectations and focusing on your shape, okay? Most of the time, most of my patients are asking for a certain shape, okay? And sometimes the skin only is gonna give so much stretch to allow me to inject to a certain point. If you continue to inject, then you sacrifice shape for volume, okay? And that's when we end up with very high buttocks or very square buttocks, okay? So it's a give and take. We want to add volume, but we want to shape that volume to the goal that you're looking for, okay? So that's my guide to know how much to inject.
And the last one.
Last
Can
question.
a patient with hypothyroidism could qualify for a tummy tuck or a BBL?
Yes, you can, but it needs to be controlled, okay? So we're gonna ask you on the blood work that you're gonna send in, we're gonna ask you to send your TSH, T3, and T4 levels, which are your thyroid hormone levels in your blood. And we're gonna ask you to get an endocrine clearance, okay? Your endocrinologist, who's the one that usually monitors and follows up your medications and your thyroid levels, needs to give us a clearance saying that you're controlled and we can go ahead and do the surgery, okay? Awesome. So I hope that all this, I know it's a lot of information, and like I said, it's here, but it's also, and this video is gonna be in my page and also in YouTube so you guys can review it. But also you're gonna get all this information in the call 60 days before your surgery and also in your patient package, okay? I hope this helped, and I hope this organized a little bit about what is the pre-op process and answer your questions, and I'll see you again next week, okay? And Tuesday Tips with Dr. Vidal. Bye-bye.